Hey everybody. Okay, so let's get into this. We're going to discuss today how to take care of your nose for the first week after your rhinoplasty or nose job surgery. So we're going to cover a couple of different topics today and really answer kind of all the questions that my patients are typically asking me after surgery, and kind of the most common things that I go over with them all the time and all the questions that I answer. So we're going to go over kind of like just in general things like gauze and dripping and like how to take care of that after nose surgery. We'll talk about bruising and swelling, kind of the normal areas and what to kind of expect after that. We'll then talk about like where the incisions are. So where are the cuts that were made during the surgery and where should we be kind of careful? Because a lot of times there's confusion about where those are and where you can kind of be and where not to be. And it can get very anxious or anxiety provoking about that. And then the last thing we're really going to go over is just cleaning in general. And that's kind of the most important part of this video, is kind of what to use to clean, how to clean, how far you can get in there, what you really should be trying to do and achieve. Because overall, after rhinoplasty or nose surgery, the cleaner your nose is on the inside, meaning that the less kind of like dry blood, dry mucus, and stuff that kind of gets in there, the more comfortable it is. So the more that you can clean that stuff out, the less stuck, the better the breathing is, and the more comfortable that you overall feel, and the nose itself does tend to heal faster as well. And so we're gonna review all of those things. So first off, it's super normal to have dripping after surgery. Now, this is normal for just kind of breathing surgery alone, if you're just doing a septoplasty surgery alone, or anything in between all the way up to a full cosmetic rhinoplasty. So you know this anytime we hit our nose or have a little bit of a nosebleed or just pick it or anything like that, the nose tends to bleed a lot, and it tends to ooze and drip. Now, we don't get a bleeding after surgery, knock on wood. It's very uncommon to have actual bleeding that you need to do something about. But the nose itself does drip, and it's always a lot more than you're going to expect, even if it isn't a lot for me or for somebody else. And you have to remember that there is a little bit of drainage that's happening, so just the nose itself is going to ooze a little bit, but you're also still making tears, right? And so when you cry, those tears come out your nose, and so when you're making tear production normally, it's going to drain into the nose, and any liquid or fluid, so tears and mucus that are made in the nose, are going to come out looking a little bit tinged with blood, just because there was surgery done in there. So it tends to seem like a lot more, but it's not all blood. It's mucus and it's tears and those different things. And so it just tends to be a little bit drippy after. And I would say that that's the top two most annoying things after surgery that you're going to experience. So number one being drippy for about, I would say, 24 hours or so, where you're going to be needing a gauze in front. And then the second thing I would say overall is those first couple of days until I see my patients back in the office, which is usually 5 or 6 days after surgery. But the second most annoying thing is congestion. People are just congested, and whether that's because I put little tiny plastic sheets in there or things just swell if they're not in there, people tend to just get congested after a nose surgery, and it's annoying. I mean, it's one of those things that's kind of a reality, and it bothers people at different levels. And it's not something that's horrible, but typically when people come back into the office, they're ready for me to kind of either get the plastic pieces out or get things cleaned up, and they walk out of there feeling amazing though. So it's a very short period of time, and it's really worth it 5 or 6 days later when you're breathing and things are open very much. So let's talk about dripping first. You probably will need some gauze. So, you can either get this from the surgery center where I operate. We tend to give people gauze after surgery, but you can buy it from any place, very easy to find, and you're going to be needing to change the gauze out pretty frequently, I would say, for the first day, especially when you get home from surgery. Now, there's different ways you can do this. You can kind of take it in a triangle, and you can kind of fold it once, and then you can fold it again, and then again you can have this kind of like underneath your nose like this. Now, you don't have to worry about putting pressure or trying to lift or do anything. You just want to gently place it right underneath the nostrils here, so that when you're having any drip, it's going to catch stuff onto this. Now, we say that a rule of thumb, if you're like soaking one of these gauze pads all the way through, every 5 to 10 minutes, and we're talking like saturated, right? Then that's a lot of bleeding, and that's something that you should definitely call us for. But if you're getting this, dirty in the sense where it's kind of filled with some blood or whatnot, and you're changing it, every hour up to 4 hours, I mean, that's really normal. A lot of times they will give, where I operate, they'll give little ear clips that go around your ears that come underneath that will hold this gauze in place here. But the goal is to fold it up small and just have something that's underneath your nose so that any drip or drainage that's coming out will be caught by that. And you're definitely gonna want something like that after any nose surgery, just because you are gonna have the drainage. You don't want it kind of going around. You don't want it on your pillow. You don't want it on your chairs. You don't want it on your carpet. And it is normal too, especially when you're thinking about it. The more you move and get active, you might have a little bit more drainage. So, if you lean or bend down, you're gonna experience that. So having some gauze at home is gonna be really, really helpful. You can buy, if for some reason the surgery center doesn't give you those holders around your ears wherever you are, you can certainly purchase them. The brand is usually Dale, D-A-L-E, but I wouldn't worry about that at all. It's very, very, very standard to get that after surgery, as well as gauze. So one thing that I would say is definitely some gauze for the dripping for about a day or two. Next thing to talk about, bruising and swelling. So where do we typically get bruising and swelling? So in the first week, you're gonna get swelling in the nose, but you're not really gonna see it because you're gonna have a plastic piece that covers this part of the bridge of your nose. And then you're gonna have some tape kind of around this area too. So that's gonna cover most of the nose and what you see. You are gonna see some swelling in this lower part. It's totally normal, but it's really not the biggest concern because you expected that. But where to see some bruising and swelling in the nose is going to be in or outside of the nose, is in this area of the face. So it typically tends to be under the eyes and around the cheeks where you tend to get the most bruising and swelling. And the nose surgery itself tends to do that. Doing the rhinoplasty surgery does that. But I will say the majority of the bruising tends to come from not a rhinoplasty when it's done well, but it's really the breaking the bones part of the rhinoplasty. So when we narrow and break the bones here, right, it's not up here that we're breaking them all the way down here. So when we break the bones and we narrow them, the breaking of the bones is the thing that tends to cause a little bit of bleeding, and that can cause the bruising underneath the eyes that you typically see after a rhinoplasty. So don't be alarmed 2 or 3 days after surgery, which is when swelling peaks after any surgery. So 2 or 3 days later, where you're feeling the most congested inside the nose and you're seeing a lot of swelling or fullness. You might not even see it as much, but you really feel it in the cheeks. And that's super normal, it's expected. If you're seeing any bruising, it's probably gonna be around these areas where it tends to be. But again, even if you're getting some bruising around 2 or 3 days after surgery, things can and do dramatically improve over the next couple of days. And typically when I see patients in my practice, around that 5 or 6 day mark up to a week, they might have some resolving bruising, but that little tingy yellow-green, but it's really not too bad. It's pretty mild, if not there at all. And the bruising has dramatically improved. So that here in the cheek area, they're looking pretty normal at that standpoint. It's really just the nose that can be a little puffy. Next thing, so here's the stuff that you really wanna pay attention for, because I get a lot of these questions too, so I can help show them visually. So number 1, where are the incisions inside the nose, and then number 2, how to take care of your nose and how to clean things. So I'm gonna use these Q-tips here, but the incisions inside our nose are basically, when we're doing a scarless or a closed rhinoplasty, they're really mirroring, I'm gonna show you on the outside, but they're mirroring where the cartilages are. So I have cartilage here and I have a cartilage here, and it's really at the lower edge, so it's right in here. So if I flip that on the inside, I'm gonna push here, but my incision would be right along here. And if you look from the bottom, they're gonna be in about this far. And in here, it would be about this far here. So they're not right at the edge always. They may be a little bit closer to the edge as you come on the inside, but they could become a little bit further away out here. But I always tell people that you can get a full, the white part of the Q-tip on the inside of your nose and nothing bad is gonna happen. You might have little bits of sutures that you would see or feel along these lines, but it's probably gonna be about, somewhere between a half a centimeter or so inside your nose where you're gonna have those sutures. And they get a little bit closer to the front as you come towards the middle part here. Sometimes you'll see little stitches on the inside here as it's coming down in this area, and that's all normal too. So in a scarless or a closed rhinoplasty, all the incisions are inside the nose here and inside the nose here, and there's nothing on the outside. When we do an open rhinoplasty, we add a few sutures and an incision at the narrowest part, which for me is right here. So it's normal to see a little incision line here and some little tiny sutures here. And again, it's more noticeable right away if you have a little bit of dry blood or something in there. Don't worry about how it looks. Those incisions always heal really, really well and really, really beautifully. but that's where the incisions are. So at the base, if it's an open rhinoplasty, and then everything's about half a centimeter or so inside. Don't judge me on my math, but somewhere where you can see in the Q-tips, they're going to be there, and you're going to be able to see them and feel them. You'll feel little tiny ends of sutures at those areas where you're going to see them, and that's where the incisions are. If you had your nostrils reduced, meaning like this, typically those sutures are going to be very visible, and they're going to be here at the base, and you're going to be able to see those very, very well. Okay. So like I said, you can get that far into your nose, nothing bad is really going to happen. Again, if anything causes you pain or pressure in anything that you do and anything that I tell you, then you should stop. If you're uncomfortable or it's causing you pain or pressure or anything that you're not happy about, then don't do it. Just wait. You can see us. Nothing bad's going to happen. It just means we have to do a little bit more cleaning in the office. I have to do a little bit more myself, and that's okay. There's some people who do an amazing job cleaning and it's totally clean and I have to do very little. And there's other people that just really aren't comfortable doing it and it's totally fine. And we just have to do a little bit more in the office, but they leave the same spot. They have the same result. It doesn't affect anything, so it's okay. Basically, I don't want you to stress. So what do we need to clean? The things that we need to clean are Q-tips. So make sure you have some Q-tips at home. The next thing you need is, I'll put this here, hopefully you can see, hydrogen peroxide. So hydrogen peroxide is super, super important. And the last thing is, Aquaphor. I can't get this thing in focus because of my camera, but hopefully you can see it. Aquaphor, there you go, close to me. So Aquaphor. So these are the 3 things you need to help clean your nose during the first part after surgery for the first week. So when to clean your nose. You don't want to clean your nose, or you can start cleaning it whenever. You can clean it the first day, but really at that point I tell people to just kind of chill, relax, take it easy. What I tell my patients is that if the nose is really wet and drippy, if things are kind of like really dripping and whatnot, you don't really need to get in there and start, using hydrogen peroxide and whatnot, make it wetter, because really what we're trying to do is we're trying to prevent things from crusting and being dry. Those are the 2 things that we're trying to prevent. So usually about a day or so later, when you feel like things aren't really dripping and running as much, then it's time to kind of focus on cleaning. Now, what do we do to clean? So we have our friends hydrogen peroxide and Aquaphor. We use peroxide to break down things that are crusty and hard, and those 2 things are going to be dry blood and they're going to be dry mucus. So this, with its bubbling action of hydrogen peroxide, is going to be the thing that helps break things down, and that's really, really key on Q-tips. The Aquaphor is used after we break things down, just to keep things kind of like hydrated so that they don't dry out. So that's like basic incision care, whether this is inside the nose, whether this is a facelift and you have incisions elsewhere. Like, this is just stuff that's going to make something clean and allow it to heal as best as possible. So the way that we do this is I would take 1 or 2 Q-tips, I would take it here, I'm going to put it inside the hydrogen peroxide, and I want this thing really, really wet. I want it like kind of saturated, soaking wet. That's really the key with the hydrogen peroxide. The more the better. You cannot do too much. And what I do is I want to have it inside my nose, and all I'm doing is I'm doing gentle rolling motions, okay? You don't need to push or scrape or do anything like that. Just laying peroxide on top of the crusty dry blood or dried mucus is going to break that down. The more you do and roll, it doesn't have to be painful, it will start breaking it down. You want to create that bubbling action of hydrogen peroxide. So instead of pushing things or trying to unroof scabs or whatever it is that you feel that's in there, don't feel like you have to do that. You really just want to get it in, and I'm just gonna roll from the inside, like from one side to the other, and I'm just rolling it around. And if I'm just on top of everything, the more that I do that, the more you're gonna see bubbles, because it's gonna be breaking down that dry blood, and it's going to soften things up. So if you keep doing that motion, the more and more you do, get another brand new Q-tip, saturate it, do it again, do another one, do it again. The more you keep doing that, it will soften up to the point that those things that seemed hard and immovable, I don't know if that's a word, they all of a sudden, they will just start rolling and cleaning off, and they will just come off. And you didn't have to pull them or do anything that was really painful, it'll just work its way off. Now, when you're kind of done cleaning for a little bit, and you've gotten a lot off or enough, or you want to be done cleaning for that period of time, then at that point we'll move on to putting a little bit of Aquaphor so that we keep the nose or the incision area. Ooh. Little technical difficulty there. I apologize. So now we'll move on to doing Aquaphor. So Aquaphor is basically, like we said, to kind of hydrate and lubricate things. And so, you know, here we have a big tub. You can use a small one. You definitely do not need a big jar like this. You can just use a smaller amount. But here I'm just taking a little bit. You can see that it's not a lot of Aquaphor on here. You really don't need a lot. And all that I'm doing is I'm going to put a thin layer of Aquaphor inside my nose on the incisions. So I would just come and I would put just a thin layer on the inside here and all the way to the outside here. And I'm just hydrating and lubricating the on top of things. Again, I'm not trying to push it. I'm just trying to have something that's kind of covering things so it doesn't dry out. Think if you had like a dry nose in that area, if you'd be putting Aquaphor there, okay? So what are the areas that you really want to focus on when you're cleaning? So the easiest kind of low-hanging fruit, if you will, is going to be here on this outside part here. And you want to make sure that you can kind of have this area open and clean as best as possible, because if you do, you know, you're going to feel better. It's not going to be as crusty and caked in. And also your breathing is going to be better too. The area that typically I see people kind of struggle with and or where I don't see a lot of cleaning done, and I'm not criticizing anyone, it's the area that's the hardest to do. But it's in this inside corner here. So kind of like see this inside part of the triangle here and then down here. So the incision typically comes all the way out and then it comes up in this little kind of corner and then it comes all the way down right in the front. So typically if you can take a Q-tip and you get one really saturated and really just letting it sit up in this corner, just letting it sit a couple and just rolling right in here is really, really helpful, because there's always a lot of crusting that happens in that area. But your goal is really from all the way at the inside part here, all the way out, trying to keep that as clean as possible. And if you start doing that and you can feel that there's not as many crusties or it's getting a lot better and that you feel better, then you're doing great. If you feel uncomfortable or having any pain or pressure or anything that you're not happy with, or let's say it causes some bleeding or something that you didn't really anticipate or whatnot, then just stop. Again, my patients can always message me and ask me questions, but that's basically the things that you're really doing for those first 5 or 6 days or that first week after a rhinoplasty surgery. I hope this demonstration was helpful. I hope the information is helpful during your post-operative recovery period, because I know this week after surgery is an interesting time. It can be a time where there's stuff that's going on that's a little bit annoying and whatnot, and also it's a hard time to be anxious about your nose and wanting to know what it looks like, but rest assured that you will see it very, very shortly. And these first 5 or 6, 7 days, they become just, you know, a blink of an eye and something that you don't even remember very quickly after surgery. If you guys have any questions or comments or anything like that, just let me know. Drop them below and I'll be happy to answer them. And thank you so much for tuning in.